What if I told you that one small Medicare change in 2026 could affect how much you pay for healthcare, the medications you rely on, and even the doctors you can see? Most Americans have no idea these changes are happening, and that's exactly why millions of seniors may be caught completely off guard. Some retirees are already discovering unexpected costs. Others are learning that certain benefits they've relied on for years may not work exactly the same way going forward. But here's what's truly surprising. One of the biggest Medicare updates isn't making major headlines, even though it could affect millions of beneficiaries across the country. And by the end of this video, you'll understand the Medicare changes many people missed and why they matter more than you think. Let's get started. What if I told you that one small Medicare change in 2026 could affect how much you pay for healthcare, the medications you rely on, and even the doctors you can see? Most Americans have no idea these changes are happening. And that's exactly why millions of seniors may be caught completely off guard. Some retirees are already discovering unexpected costs. Others are learning that certain benefits they've relied on for years may not work exactly the same way going forward. But here's what's truly surprising. One of the biggest Medicare updates isn't making major headlines, even though it could affect millions of beneficiaries across the country. And by the end of this video, you'll understand the Medicare changes many people missed and why they matter more than you think. Let's get started. As a result, many beneficiaries don't realize what's changed until they receive a bill, visit a doctor, or try to fill a prescription. Today, we're breaking down the Medicare changes you may have missed, what they could mean for your health care, and how to prepare. And make sure you stay until the end because one of the final updates could save some beneficiaries hundreds or even thousands of dollars over time. Healthcare costs continue to rise across America. Hospitals face increasing expenses. Prescription drug prices remain a major concern. Medical technology continues advancing, and Americans are living longer than ever before. These factors place enormous pressure on healthcare systems. To address these challenges, Medicare regularly adjusts rules, coverage structures, and payment systems. Many of these updates are designed to improve efficiency and reduce costs. Others are intended to help beneficiaries gain access to better healthcare services. But not every change is immediately obvious. In fact, some of the most important updates happen behind the scenes. And one of those changes is creating a lot of discussion among healthcare experts. We'll get to that in just a moment. For years, prescription medications have been one of the biggest concerns for retirees. Many Americans depend on multiple medications every month. Even modest price increases can create financial stress. That's why recent Medicare reforms have placed greater attention on prescription drug spending. Some beneficiaries may notice changes in how certain drug costs are calculated. Others could see adjustments related to out-of-pocket expenses. Healthcare analysts believe these changes could significantly impact how retirees budget for medical costs in the future. But here's the interesting part. Not every beneficiary will experience these changes in the same way. And that's where things become more complicated. Because the next Medicare update could affect access, not just cost. Imagine scheduling an appointment with a doctor you've trusted for years, then suddenly discovering that your healthcare plan has changed. This situation happens more often than many people realize. Every year, Medicare Advantage plans and other healthcare options may update provider networks. That means certain doctors, specialists, hospitals, or healthcare facilities may join or leave specific plans. For beneficiaries who don't review their annual coverage details carefully, these changes can come as a surprise. Healthcare experts recommend reviewing plan information every year instead of assuming everything remains unchanged. Because sometimes the most important healthcare decision isn't about cost. It's about maintaining access to the providers you trust. And what we're about to discuss may be even more important, because it involves preventive care, and many Americans overlook it completely. One of Medicare's primary goals is preventing serious health problems before they become more expensive and difficult to treat. That's why preventive services continue receiving increased attention. Screenings, wellness visits, early detection programs, routine monitoring. These services may not seem exciting, but they can dramatically improve long-term health outcomes. Healthcare professionals often say that prevention is one of the most valuable tools available to patients. The challenge? Many beneficiaries fail to take advantage of these services, And when they skip preventive care, they may miss opportunities to identify health concerns early. But preventive care isn't the only area changing. The next update involves technology, and it's transforming healthcare in ways few people expected. A few years ago, many patients rarely considered virtual healthcare appointments. Today, telehealth has become an important part of modern medicine. Patients can consult healthcare providers from home. Follow up appointments may be more convenient. Certain medical questions can be addressed without lengthy travel. This has been especially beneficial for seniors living in rural areas or individuals with mobility challenges. As healthcare systems continue evolving, telehealth remains a major topic of discussion. Many experts believe digital healthcare services will play an even larger role in the future. But while convenience is increasing, another challenge remains, and it affects nearly every Medicare beneficiary: healthcare affordability. That's where we'll go next. Let's talk about something that catches many Medicare beneficiaries completely off guard: out of pocket costs. Most people focus on premiums because they're easy to see. The bill arrives every month. You know exactly what you're paying, but premiums are only part of the story. The real surprise often comes from deductibles, co-payments, co-insurance, and unexpected medical expenses. Imagine visiting a specialist, then needing follow-up testing, then receiving treatment. Each step may involve additional costs. Individually, they might not seem overwhelming, but over time, they can add up quickly. This is one reason healthcare experts encourage retirees to look beyond monthly premiums when evaluating Medicare plans. The cheapest plan on paper isn't always the least expensive option in practice, and that's where many people make a costly mistake. But healthcare costs aren't the only thing changing. There's another issue that's becoming increasingly important for millions of Americans, and it involves prescription medications. For many retirees, prescription medications are not optional. They're essential. Some beneficiaries take medications daily for blood pressure. Others rely on prescriptions for diabetes, heart conditions, arthritis, or chronic illnesses. That's why even small changes in prescription drug coverage can have a major impact. Many healthcare analysts believe medication affordability will remain one of the biggest healthcare issues of the decade. The challenge isn't simply the price of medications, it's understanding how coverage works. Which drugs are covered? Which pharmacies offer the best pricing? Are there lower cost alternatives? These questions can significantly affect annual healthcare spending. And here's something many people don't realize: the same medication can sometimes cost dramatically different amounts depending on where and how it's purchased. That's why reviewing your coverage annually is so important. But the next Medicare change isn't about medication. It's about something even more valuable: your choice. Many Medicare beneficiaries make one simple mistake. They enroll in a plan, then never review it again. Year after year, they assume everything remains the same. But healthcare plans change, coverage changes, costs change, provider networks change, benefits change, and those changes can directly impact your healthcare experience. Financial experts often compare Medicare reviews to reviewing insurance policies. You wouldn't buy a car and ignore maintenance forever? The same principle applies here. Even a quick annual review could reveal better coverage, lower costs, additional benefits, improved provider access. The problem is that many retirees don't realize a better option exists until it's too late. And speaking of benefits, some Medicare benefits remain surprisingly underutilized. Ask most people what Medicare covers, and they'll immediately mention hospital visits and doctor appointments. But Medicare often includes additional services that many beneficiaries rarely discuss: preventive screenings, wellness visits, health assessments, disease prevention programs, health education resources. These benefits exist for a reason. Healthcare providers know that early intervention often leads to better outcomes. The earlier a health issue is identified, the easier it may be to manage. Yet millions of Americans fail to use services that could potentially improve their health and quality of life. Healthcare professionals frequently describe this as one of the most overlooked opportunities within the Medicare system. But even as benefits expand, another challenge is emerging, and it's changing how healthcare is delivered across America. The healthcare system today looks very different than it did 20 years ago. Digital records, virtual appointments, remote monitoring, online prescription management. Healthcare technology continues evolving at an incredible pace. For some seniors, these advancements create convenience. For others, they create confusion. Many retirees appreciate being able to communicate with healthcare providers online. Others worry about privacy, security, or learning new technology. The reality is that digital healthcare isn't going away. In fact, experts believe technology will become even more integrated into healthcare services over the next decade. This transformation could improve access, efficiency, and patient outcomes. But it also raises important questions about affordability, because even with technological improvements, healthcare costs remain a major concern. And that's where our biggest revelation begins. The biggest Medicare change most people miss. After reviewing all these updates, one conclusion becomes clear. The biggest Medicare change isn't a single policy. It's the growing responsibility placed on beneficiaries to stay informed. Years ago, healthcare decisions were often simpler. Today, Medicare beneficiaries face more options than ever before. More plans, more coverage choices, more healthcare providers, more prescription options, more technology, more information. And with more choices comes greater responsibility. The beneficiaries who stay informed are often in the strongest position. They understand their coverage. They review plan updates. They monitor healthcare costs. They ask questions. They prepare for changes before those changes affect them. Meanwhile, those who ignore updates may discover important changes only after experiencing unexpected costs or coverage issues. That's the reality many healthcare experts want retirees to understand. Knowledge has become one of the most valuable healthcare benefits available. And unlike premiums or deductibles, staying informed doesn't cost anything. So, what have we learned today? Medicare continues evolving. Healthcare costs remain a major concern. Prescription drug coverage is changing. Provider networks may change. Technology is transforming healthcare. Preventive services remain critically important. And perhaps most importantly, the beneficiaries who stay informed are often the ones who make the best healthcare decisions. Medicare isn't just about receiving healthcare, it's about understanding how the system works and making choices that support your health and financial well being. The more informed you become, the better prepared you'll be for whatever changes come next. If you found this information helpful, make sure to subscribe and turn on notifications. We regularly cover Medicare updates, Social Security news, retirement strategies, and important financial information that could affect millions of Americans. And now we'd like to hear from you. What's your biggest concern about Medicare in 2026? Healthcare costs, prescription drugs, coverage changes, or something else entirely? Leave a comment below and join the conversation. Thanks for watching, and we'll see you in the next update.